Welcome to Rare's A Health, your ultimate health and wellness guide. Subscribe for easy-to-follow health guides, motivation, and expert insights to transform your health. Heart disease remains one of the leading causes of death worldwide, yet many people fail to recognize its warning signs until it's too late. While some symptoms, like chest pain, are well-known indicators, others, such as fatigue, shortness of breath, or pain in unexpected areas, can be more subtle but equally important. Understanding these early signs and taking proactive steps to improve heart health can significantly reduce the risk of serious complications. By making lifestyle changes, managing risk factors like high blood pressure and cholesterol, and staying informed about potential warning signs, you can protect your heart and overall well-being. This video will explore the key symptoms of heart disease and effective ways to maintain a strong, healthy heart for years to come. Chest discomfort, angina. A key warning sign, chest discomfort, often referred to as angina, is one of the most common early signs of heart disease and should never be ignored. It typically manifests as pain, tightness, pressure, or a squeezing sensation in the chest, which may occur during physical exertion, emotional stress, or even while at rest in more severe cases. This discomfort arises due to reduced blood flow to the heart muscle, often caused by narrowed or blocked coronary arteries. Angina can sometimes be mistaken for indigestion or muscle strain, but persistent or worsening symptoms may indicate an increased risk of a heart attack. Recognizing and addressing chest discomfort early by seeking medical attention and making heart-healthy lifestyle changes can help reduce the risk of serious cardiovascular complications. Shortness of breath. A potential warning sign of heart disease. Experiencing difficulty breathing, particularly during physical exertion or while lying flat, can be an important indicator of underlying heart issues such as heart failure or coronary artery disease, CAD. When the heart struggles to pump blood efficiently, fluid can build up in the lungs, leading to breathlessness, even with minimal activity or at rest. This symptom, known as dyspnea, may also be accompanied by fatigue, dizziness, or swelling in the legs and ankles. In heart failure, shortness of breath can worsen at night, making it difficult to sleep without propping up the upper body. If left untreated, these breathing difficulties can progressively limit daily activities and signal a heightened risk of more severe cardiovascular complications. Recognizing and addressing shortness of breath early through medical evaluation and lifestyle changes can help manage heart disease and improve overall heart function. Fatigue. A subtle but serious warning sign of heart disease, unusual or persistent fatigue, even after getting enough rest, can be an early sign that the heart is not functioning efficiently. When the heart struggles to pump blood effectively, the body prioritizes sending oxygen-rich blood to essential organs like the brain and lungs, reducing circulation to muscles and tissues. This can lead to constant exhaustion, weakness, and difficulty performing routine activities. Fatigue related to heart disease is often more pronounced after physical exertion and may be accompanied by other symptoms such as shortness of breath, dizziness, or swelling in the legs. While fatigue can stem from various causes, including stress and lifestyle factors, persistent or worsening tiredness, especially when combined with other cardiovascular symptoms, should not be ignored. Seeking medical evaluation and making heart-healthy changes can help prevent further complications and improve energy levels. Swelling in legs, ankles, or feet. A possible indicator of heart issues. Unexplained swelling in the legs, ankles, or feet, known as edema, can be a warning sign of heart failure or poor circulation. When the heart is unable to pump blood efficiently, blood can back up in the veins, leading to fluid retention in the lower extremities. This swelling may worsen throughout the day, especially after prolonged sitting or standing, and can sometimes be accompanied by a feeling of heaviness, tightness, or discomfort. In some cases, pressing on the swollen area may leave a temporary indentation, known as pitting edema. Poor circulation caused by weakened heart function can also slow the removal of excess sodium and fluid from the body, further contributing to swelling. While mild swelling can result from other factors such as a sedentary lifestyle or high salt intake, persistent or worsening edema should be evaluated by a healthcare professional to rule out serious heart-related conditions and prevent complications. Irregular heartbeat, arrhythmia, when your heart's rhythm signals trouble. An irregular heartbeat, also known as arrhythmia, can manifest as palpitations, skipped beats, fluttering sensations, or a racing heart. While occasional irregularities may be harmless and triggered by factors such as stress, caffeine, or dehydration, frequent or persistent arrhythmias could indicate an underlying heart condition. Arrhythmias occur when the electrical signals controlling the heartbeat become disrupted, causing the heart to beat too fast, tachycardia, too slow, bradycardia, or in an incoordinated manner. Certain types, such as atrial fibrillation, AFib, can significantly increase the risk of stroke and heart failure if left untreated. Other symptoms like dizziness, chest discomfort, shortness of breath, or fainting alongside an irregular heartbeat may signal a more serious cardiac issue requiring immediate medical attention. Identifying and managing arrhythmias through lifestyle changes, medications, or medical procedures can help restore normal heart function and reduce the risk of complications. Dizziness or lightheadedness, a possible sign of reduced blood flow. Experiencing dizziness or lightheadedness, particularly when standing up or moving suddenly, can be a warning sign that the heart is not pumping blood effectively. This symptom often occurs when blood flow to the brain is temporarily reduced, which may be caused by low blood pressure, arrhythmias, or heart failure. In some cases, conditions like atrial fibrillation, AFib, or heart valve disease can disrupt normal circulation, leading to episodes of dizziness, fainting, or unsteadiness. While occasional lightheadedness can result from dehydration, low blood sugar, or standing up too quickly, frequent or unexplained dizziness, especially when accompanied by chest discomfort, shortness of breath, or palpitations, should not be ignored. Seeking medical evaluation can help determine whether an underlying heart condition is contributing to these symptoms and ensure timely intervention to prevent potential complications. High blood pressure, hypertension, the silent threat to heart health. High blood pressure, or hypertension, is one of the leading risk factors for heart disease, yet it often develops without noticeable symptoms, earning it the nickname, the silent killer. When blood pressure remains consistently elevated, it forces the heart to work harder to pump blood, which can lead to strain on the arteries, increasing the risk of heart attacks, strokes, heart failure, and kidney disease. Over time, uncontrolled hypertension can cause arterial damage, reducing blood flow to vital organs and contributing to complications like vision loss or cognitive decline. Because hypertension often goes unnoticed until it leads to serious health issues, regular blood pressure checkups are crucial for early detection and management. Lifestyle changes such as a heart-healthy diet, regular exercise, stress management, and, in some cases, medication can help maintain optimal blood pressure levels and reduce the risk of cardiovascular complications. High cholesterol, a hidden contributor to heart disease. High cholesterol, particularly elevated levels of low-density lipoprotein, LDL, commonly known as bad cholesterol, is a major risk factor for heart disease. When LDL cholesterol levels are too high, it can lead to the formation of plaque, fatty deposits that accumulate along artery walls, causing them to narrow and harden. This condition, known as atherosclerosis, restricts blood flow to the heart and other organs, significantly increasing the risk of heart attacks and strokes. On the other hand, high-density lipoprotein, HDL, or good cholesterol, helps remove excess LDL cholesterol from the bloodstream, reducing plaque buildup. Low levels of HDL can make it harder for the body to maintain healthy arteries. Since high cholesterol often presents no symptoms, regular screening is essential for early detection. Managing cholesterol through a balanced diet rich in fiber and healthy fats, regular exercise, and, if necessary, medication can help keep cholesterol levels in check and protect heart health. Persistent cough or wheezing, a potential warning sign of heart failure. A chronic cough or wheezing, especially when accompanied by white or pink-tinged mucus, can be an indication of fluid buildup in the lungs due to heart failure. When the heart is unable to pump blood efficiently, fluid can accumulate in the lungs, a condition known as pulmonary congestion. This can cause a persistent, sometimes worsening, cough that may be more noticeable when lying down or during physical activity. In more severe cases, the cough may produce frothy or blood-tinged mucus, signaling advanced heart failure. Wheezing or shortness of breath often accompanies this symptom, as excess fluid in the lungs makes it harder to breathe. While a persistent cough can also be caused by respiratory conditions such as asthma or infections, when linked to heart disease, it requires prompt medical evaluation. Managing heart failure through lifestyle changes, medications, and appropriate treatment can help reduce fluid retention and improve breathing. Snoring or sleep apnea, a hidden risk factor for heart disease. Loud snoring, frequent gasping or choking during sleep, and excessive daytime drowsiness may be signs of sleep apnea, a sleep disorder that can significantly impact heart health. Sleep apnea occurs when breathing repeatedly stops and starts during sleep due to airway obstruction, obstructive sleep apnea, or disrupted brain signals, central sleep apnea. These pauses in breathing lower oxygen levels, forcing the heart to work harder and increasing the risk of high blood pressure, irregular heartbeats, arrhythmias, heart failure, and stroke. Over time, untreated sleep apnea can contribute to chronic stress on the cardiovascular system, leading to inflammation and plaque buildup in the arteries. Because symptoms often go unnoticed by the individual, partners or family members may be the first to observe them. Proper diagnosis through a sleep study and treatment with lifestyle modifications, continuous positive airway pressure, CPAP, therapy, or other medical interventions can help reduce strain on the heart and improve overall health. Unhealthy lifestyle habits, major contributors to heart disease risk. Unhealthy lifestyle habits are among the most significant contributors to the development of heart disease. Smoking, for instance, damages blood vessels, raises blood pressure, and lowers oxygen levels in the blood, all of which can increase the risk of atherosclerosis and heart attacks. A sedentary lifestyle, characterized by little to no physical activity, weakens the heart and contributes to weight gain, high cholesterol, and high blood pressure, all of which elevate heart disease risk. Diet plays a critical role as well. Consuming a diet high in saturated fats, sugars, and salt can lead to elevated cholesterol levels, high blood pressure, and increased inflammation, all of which strain the cardiovascular system. Excessive alcohol consumption can raise blood pressure and lead to irregular heart rhythms, while chronic stress can cause hormonal imbalances that contribute to high blood pressure and inflammation. Together, these habits create a dangerous combination that significantly raises the likelihood of heart disease. Making healthier choices, such as quitting smoking, exercising regularly, eating a balanced diet, reducing alcohol intake, and managing stress, can greatly reduce the risk and improve overall heart health. Diabetes or insulin resistance, a key risk factor for heart disease. Diabetes, particularly when blood sugar levels are poorly controlled, and insulin resistance are major risk factors for heart disease. High blood sugar levels can lead to the accumulation of excess glucose in the bloodstream, which over time damages blood vessels, making them more prone to narrowing and hardening, atherosclerosis. This impaired circulation can significantly reduce blood flow to the heart and other vital organs, increasing the risk of heart attacks, strokes, and other cardiovascular complications. Additionally, diabetes can affect the nerves that control the heart, potentially leading to issues such as abnormal heart rhythms, arrhythmias, and autonomic dysfunction. Insulin resistance, a condition where the body becomes less responsive to insulin, can also contribute to high blood sugar, further exacerbating the strain on the cardiovascular system. Individuals with diabetes or insulin resistance are also more likely to have high cholesterol, elevated blood pressure, and inflammation, all of which compound the risk of heart disease. Managing blood sugar levels through medication, a balanced diet, regular exercise, and weight control is essential to reduce the impact of diabetes on heart health and lower the risk of cardiovascular problems. Unexplained sweating, a possible indicator of heart problems. Unexplained sweating, especially cold sweats that occur without physical exertion or in unusual circumstances, can be a potential warning sign of heart issues. This type of sweating may occur during a heart attack or in the presence of other serious cardiovascular conditions, as the body reacts to reduced blood flow or stress on the heart. Cold sweats are typically a sign that the body is in a state of shock or distress, and when associated with symptoms like chest pain, shortness of breath, or dizziness, they can indicate that the heart is struggling to pump blood effectively. Sweating that happens without a clear cause, especially in stressful or sudden situations, can be linked to a heart attack, angina, chest pain, or arrhythmias, irregular heartbeats, where the body's stress response is triggered. If cold sweats are accompanied by discomfort or pain in the chest, it's crucial to seek medical attention immediately, as these could be signs of a heart emergency. Pain in other areas, a warning sign of heart trouble. Heart-related pain isn't always confined to the chest. Discomfort or pain in the neck, jaw, throat, upper abdomen, or back can sometimes signal an underlying heart problem, particularly when it occurs alongside chest pain or other symptoms like shortness of breath, nausea, or sweating. This type of pain, known as referred pain, happens because the heart, nerves, and surrounding structures share complex pathways that can cause discomfort to radiate to different areas of the body. For instance, pain in the jaw or neck, especially in women, may indicate a heart attack, while upper back pain could be a sign of strain on the heart due to restricted blood flow. Additionally, upper abdominal pain may sometimes be mistaken for indigestion or acid reflux, delaying proper diagnosis. If unexplained pain in these areas persists or worsens, particularly with other heart-related symptoms, seeking immediate medical attention is crucial to rule out serious cardiovascular conditions. If you experience any of these symptoms or have multiple risk factors, consult a healthcare professional for evaluation and guidance on reducing your risk of heart disease. Early detection and lifestyle changes can significantly improve heart health. If you enjoyed this video, hit that like button, subscribe, and turn on notifications so you never miss a new tip. Thanks for watching, and I'll see you in the next video.